Okay, and so I'm Amy Sturrock. I know that I have met with you or seen you on Zoom probably multiple times, and obviously you're getting a lot of emails from me as we prepare for the summer start of our traditional pathway program. And I want to say thank you all for joining today. I know this was short notice. And so part of the reason we're recording these sessions is to share them with the entire cohort. And I anticipate having the video to be able to share with students by the end of next week. And so before we get started with an overview of the morning, I want to take a moment and introduce one of my colleagues, Colin Miller. Colin, do you want to activate and just give us a wave or say hello, just a quick hi, just so the students can see you? I don't always know what students are seeing on a Zoom format.
Hey everybody, good morning.
There he is. So Colin is our student engagement coordinator, and he was hired, gosh, I guess a few months ago now. So he is new and learning the ropes, and I'm appreciative of his help, and I thank him for being here this morning. So you'll be seeing his name in terms of interactions regarding orientation and also future events down the road. And ultimately, when you get to the graduation timeline, Colin is overseeing commencement activities as well. So that you'll be seeing Colin's name, and we always just want to make sure that you can see a name with a face, and obviously you'll be meeting him during orientation week as well. So I just want to take a minute and go over the plan for the morning. So Dr. Farah Bowler, who is the Senior Director of the Experiential Learning team, will be joining us with a couple of members of her team at 9:30. And the Experiential Learning team handles all clinical placements and simulation. So she'll be going over some very important information about vaccinations, what you need to be doing for American Data Bank. And as you probably know, that the deadline for compliance is May 11th. So we just want to remind students of that. And she'll also be just kind of going over some general information about clinical placements. And then following Dr. Bowler, Joanna Cabrera-Rosas, who's a financial aid advisor and our primary liaison for the College of Nursing, will be joining us to talk a little bit about the aid process and also answer questions that you might have. And then we will have an access coordinator from the Office of Disability Access and Inclusion, and that's Maxine Lomax. She's going to be joining us after Joe. And then after that, we will have a panel, question and answer panel. We've got a couple of alums that are going to be joining us, and then several current students. So that'll be a great time for you to, ask questions of students who have been where you are, and some more recently than others, but just to kind of talk about the student experience and, to provide some advice and to answer questions that you all have. So between now and the time that Dr. Bowler joins us, I wanted to kind of just touch base and check in with you all to let you know kind of what you should have done at this point, and then what action steps are needed between now and orientation and obviously the start of the program. So hopefully by now, unless you're using a tuition waiver because you're working in the CU system or you're a dependent of a CU employee, hopefully you've registered for summer classes at this point. If you have any issues, I know a couple students have reached out over the last few weeks about having issues with registration. And so your residency status needs to be determined before you can register. But if there's any other barriers or issues that you're facing, please let me know, and I can forward that request to our Office of Academic Programs so they can troubleshoot and figure out what's happening. If you are having issues registering, don't panic, because you have a spot in your classes. So that is the one nice thing about the prescribed nature of the nursing curriculum, is that your plan of study will guarantee that you've got courses in the sections that you're assigned to each semester. So just, if you haven't registered or you just are having problems, please let me know if there's anything we can help troubleshoot. In terms of the emails that I've been sending weekly, I wanted to give you an update on where those are going in the future and what you should have done already. So Hopefully you've all uploaded your photo in the badging survey. I've left it open because sometimes students just need a little bit more time, but I am going to close that survey this afternoon. So if for some reason you have not uploaded your badging photo and information, please do that today. That way I can get the photos to the office, the badging office next week. And if there's any problems with the formatting of the photos, I'll let you know, so that we can figure out what you need to be doing to get a photo that will be acceptable by the badging office. There are very strict requirements for them because they come out on very small, on your badges. The picture is fairly small, but they have just, as the requirements outlined in that survey that I sent you, sometimes they just need a different photo. So if that happens, we'll communicate that with you. You will get your badge during orientation week. Our goal is to hand them out on the first day of orientation on May 31st, which is a Tuesday. So in addition to submitting that badging photo, hopefully by now you've also submitted the information for that clinical placements survey. That information is absolutely critical. I will be sending that information to Dr. Bowler and her team probably Wednesday or Thursday of next week. And I need to go into the survey to make sure that students have entered all the correct information. So I would say, similar to the badging survey, if you have not done that survey, please do it today, no later than 5 o'clock. I can see Emily, your hand's up, and I'll get to you in just a second. So yeah, please make sure that you go ahead and complete those surveys. I closed that scrubs sizing survey earlier this week and forwarded all of the information to our bookstore manager, who is Vicki Schenk. And I have not yet heard from Vicki that the sample sizes have arrived. So again, please hold off on actually physically going into the bookstore to try on scrubs, because she won't have all the sizes at this point. I'm hoping in the next couple of weeks that she does, so that, basically what she does is she takes the results of the survey of the general sizing that we think students will need. She'll place a mass order with the scrubs company. The tops come to us embroidered with the CU Nursing logo on them. And then so she'll order the tops and the pants. And then what typically happens is students will have time when she has a set of all the sizes to go in and just try on scrubs before you actually do your order for the scrubs. And a lot of times students will order their books and their scrubs at the same time. And we'll provide more details about the textbooks. I don't know if it will be out. It's not going to be out today. It may be out to students by the end of next week, but it may not be till the following week. I think we're in the final stages of the textbook lists. And keep in mind, when we send you the textbook lists, it's going to be for the entire program, for the entire 2 years. So there's a lot of work that goes into that. And I know that we do have some textbook changes from prior years, new additions, potentially totally new textbooks. So please hold off on purchasing anything. I mean, I know that sometimes current students in the program, and they let you know that they can sell you their books or give you their books. I would say just don't purchase anything at this point until you know for sure what's going to be needed. And we always recommend that students purchase the book bundle. It does save you money in the long run. Yes, I know it's a large output. I don't know what the cost is going to be for this year's bundle, but in the past it's ranged from anywhere between like $1,800 to $2,000. But keep in mind, that's going to be the vast majority of books for your entire program. And when you look at the cost savings, it typically saves students around $400 to $500 by doing the bundle in the long run. And so I see some hands up, and I'll get to those questions in just a few minutes. I just want to make sure I get through some of the key items that I want to make sure I address before Dr. Bowler joins. So be looking out for future notifications about the textbooks. And regarding my weekly emails, we're in the process now of activating our what we call Canvas shell. And Canvas is our online platform where you'll be doing online course content. You'll do some online orientation modules. You'll get lots of information from experiential learning about clinicals and placements. And so Dr. Bowler is working on getting some content into her part of the Canvas shell. And this will make more sense once you access Canvas. But if you've ever used D2L or Blackboard, Canvas is what we use at CU. And it's that similar, online format. And so we want to launch the shell to you early, and I will send the Canvas shell link out to students later this afternoon. And going forward, that's where I'll put all the weekly announcements. So you're not going to be getting an email from me every Friday from this point forward, because I'm simply going to be adding the announcements out to the Canvas shell. And that way you can look during the week just to see what's out there to make sure you're staying on top of what you're needing to do. And like I said, Dr. Bowler will be adding announcements as well about placements, simulation, all things experiential learning. So keep an eye out for that email. And I would also say you have to have an active CU email address to be able to link to the Canvas shell. So if you haven't done so yet, for whatever reason, please activate your CU email. You should have a cuanschutz.edu address. However, some students, if you have been a prior student at CU Denver, let's say, then you might still have a UC Denver address. And that's totally fine. You can keep the UC Denver address if you want, or you can ask IT to change to a CU Anschutz account, but keeping a UC Denver account is totally fine. So you just something to think about. Trying to think what else in terms of an initial items. We have not yet launched the scholarship application for fall. We plan to do so, I'm hoping, in the next couple of weeks. And again, that will be added to the announcements page when that time comes. Just kind of looking at my list here. In terms of registration, Dan Hussey had provided a very detailed attachment when he sent your plan of study information, and that was great information showing you how to navigate the portal and register. If down the road you need to make changes to your schedule, I mean, you can't change sections, but if you need to access your records, you would always do that in the portal. From my understanding, and I'm going to double check my the bursar's calendar here while I'm going through kind of this checklist. I believe that the summer bills will post to student portals on May 3rd. So at that point, you'll be able to see all of your charges and be able to determine, looking at the due dates for summer tuition. Generally speaking, May 31st is going to be that deadline for summer tuition. If you don't pay your bill by that point, you're not going to be dropped from your classes. I mean, that's the good news, but your bill will kind of roll forward. And then the next due date is typically the end of June. So I've given you all that link to the bursar's calendar in a couple of emails. So make sure you refer to that in the future if you've got questions. And I know that when Joanna Cabrera Rosas joins us later this morning, she'll talk about the awarding process. They typically don't start awarding until, I think, somewhere late April, but she'll go over that. And just note that, when you're thinking about the transition to CU, we're working on entering transfer credit now. And so once students are at a junior level, then you're eligible to get financial aid. Okay, so all of you will be at that junior level, due to courses you've had in the past or courses you're taking this semester. But just note that financial aid cannot be dispersed until you're at the junior level. And so for those of you that need to have your spring 2022 courses entered into the system to reach that 60 credit hour mark, your financial aid package is essentially on hold. Okay. That's just the way the CU system operates, and there cannot be a dispersal prior to that time. So please be patient as we work through the transfer credit process. our team has to enter every single past course you've taken into the system for every student. We're looking at a total cohort of probably around 230 students for the summer. So it's a lot of work on our end to get that done. We will do that as efficiently as we can as we get spring courses grades. And so what I'll do, I'll have an announcement probably next week about just reminding students once your spring grades post, if you are currently enrolled in courses, to make sure you get official updated transcripts submitted to Nursing CAS. For those of you that are integrated nursing pathway students, since your application was done in a previous Nursing CAS cycle, you're actually going to initiate electronic transcripts to come to our office directly, and I'll provide you all, the IMP students, integrated nursing pathway, with a separate email about that process. But for the students that apply directly to the traditional pathway, that you still have access to your application, you'll need to update your grades for spring, and then have an updated official transcript sent to Nursing CAS on your behalf as well. So again, I would say do that as soon as you can, once those spring grades post. So I think I'm going to stop there, and I'm going to ask Emily to unmute and ask your question.
Hi, thanks so much, Amy. I actually
Sure.
have a few questions. Sorry, they
Sure.
kept coming as you went through things.
Yeah.
The first question I had is there a number of recommended amount of scrubs that we should buy? Like we should buy 2 sets, 4 sets?
Yeah, that's a good question. And we actually do get that. I mean, and Dr. Bowler may cover this as well, but I would typically recommend having at least 2 sets. And, really that's due to the fact that, I mean, you never just want to have one, because if you've got back-to-back clinical days, you always want to have a fresh pair of scrubs ready to go. And one thing I want to comment on that as a piggyback is you're not required or expected to wear scrubs in the didactic classroom. So when you're doing like your general coursework, you don't wear your scrubs. However, you will be required to wear your scrubs for any sort of clinical experience, whether it's an on-site in simulation, clinical skills lab, or of course for off-site clinicals, anything in a live patient setting, or when you're doing your patient prep prior to doing clinical assignments, you're going to be expected to wear your scrubs. So yeah, I would generally say get 2 sets, and I wouldn't, if you're wanting to purchase more than that, I would say please don't do it right away, because there is a finite number of scrubs that the bookstore will have. So I would say maybe, start with 2 sets. If they don't have 2 sets for whatever reason at the time you go to buy them, purchase 1 set, and then, just communicate with Vicki in the bookstore that obviously you're needing some additional scrubs. So, we just want to make sure that everybody has at least 1 set, going into like that first week of classes, because you will need them during that time frame. But yeah, I would say down the road, if there's enough, if Vicki says there's enough supplies in the bookstore that you can go ahead and order 2 sets right away, or pick up 2 sets, that's fine. And I know that when you do the orders, I mean, they typically recommend doing the orders online. And when you get your scrubs in the mail, if they are too small, too big, as long as you keep the tags on, you can go into the bookstore and Vicki can help you swap them out for the correct size. If you don't have a chance to go in and try on scrubs, or if you're not local, before you purchase those scrubs. So I'm sorry, that was a really long answer, Emily. What were your other questions?
It's thorough. The other question I had, I'm pretty sure that I've completed all of the survey links that you've sent out. I've tried to do them as you've sent them. But is there any way to confirm that we've done everything that we're supposed to?
Yeah, what I'm going to do is, like I said, I'm going to keep the badging and the clinical surveys active until 5 o'clock today. And then I'm going to go ahead and turn them off because I need to start working on processing the information. But as I go through them next week, if I note that a student has not completed the information, I'll reach out. So Emily, I guess I would say no news is good news. If you don't hear from me, that means you're good to go at this point.
That's, yeah, makes it easier and streamlined. That makes sense.
Yep.
You've kind of answered this in your question, or in your talk about books, but I was just curious about how critical it is to have the most recent version of a given book.
I would say it's critical. And in it, and sometimes, the new editions have some minor changes, but sometimes they're fairly substantial. So I would say, you need to go with the versions that the faculty have confirmed that they're going to be using, just to be on the safe side.
Okay.
And just to comment a little bit further on that, students certainly have the option of purchasing textbooks semester by semester. And Dr. Spencer, who's going to be your health assessment instructor, and she's our assistant dean for undergraduate programs. She's putting together all the textbook information, a welcome letter, which kind of outlines exactly what you need to be doing in terms of like getting supplies, how to prepare, and also like what books you need for each class. So if students decide that you want to purchase them semester by semester, you've got the ISBNs so that you know exactly, and the ISBN is the identifier for each individual book, so that you know that you're getting the correct textbooks going forward.
Okay, perfect. And then I think the two final questions I have. One is regarding transcripts. So I'm in the MPH program here at CU. I have a final transcript coming out for just one class, but I don't think it's relevant to the nursing school. Do I need to have those reset?
Yeah, still go ahead and just do a final transcript
Okay.
to be submitted to Nursing House once your semester's done, Emily.
Okay, great. And then the last question, kind of relevant to that. So I already have Canvas through the Colorado School of Public Health. Is there any thought on whether or not those will conflict having it through the nursing school as well, or will it just be a new course that opens?
It shouldn't conflict. I mean, I'm not a Canvas expert, but my understanding is that I'm going to send you, when I send the shell link later today, it's going to be called the Traditional Pathway 2022 cohort. That should just, I think, Emily, just show as an additional course on your profile in Canvas.
Perfect. That's what I was hoping for. Thank you so much for all of your help and answering my gazillion questions.
Yeah, no, happy to help, Emily. And then I know we had a question in the chat about physical books versus ebooks. Historically, there's been ebook options as well. And so, but all will be revealed, when you get that email that I'm going to pass along on behalf of, it's going to be posted to Canvas at this point. But if there's any documents that we can't post as part of Canvas, then we'll send them by email to make sure that you've got all the information. And I just was checking in the chat. I don't think I see any other questions in the chat. Caroline, what are your questions?
I wanted to ask, for those of us that had completed our prereqs, do we still need to upload a final transcript to Nursing Cast?
No, if you had all of your courses completed and you aren't in progress with any courses in spring or winter of 2022, you don't have to do anything. Okay. We as long as all your final transcripts are already posted in Nursing Cast, then you're good to go. However, if any courses were in progress at the time that you accepted your admission, whether again, winter 2022 or spring of 2022, we need to see all those course grades in Nursing Cast.
Okay, thank you.
You're welcome.
I also have a question about the passport for the badging. So I did make a mistake. I did not put my name the way it was supposed to come, like you showed us in the sample.
Okay.
I did. Do I need to re-upload it and do it correctly?
I don't think so. I mean, Carolyn, what I'll do is I have to do a lot of background work on the photos and the information before I send them to badging. And so if during my process, if I see anything that needs to be updated, I can typically rename a file or resize a picture if needed. But again, if you don't hear from me, don't worry about it.
Okay, thank you.
Sure. I think Bria, you're next.
Okay, hi.
Hi.
Hi. So I think I just missed the info on when the scrubs will be available to try on and then order.
Yeah, and I just saw that in chat too.
Yeah.
Thanks for that question. So I have not yet heard from Vicki Shank in the bookstore that she's received samples yet of all the sizes. So it's not time yet, Bria, to go into the bookstore to try on. But I will post an announcement to the Canvas shell as soon as I hear from Vicki that she's got the sample sizes. And so you wouldn't be going into the bookstore at that point to like purchase your scrubs. You would just be trying them on so that when you go to the point of ordering that you know what sizes that you'll want to get. So the ordering information will come out probably at the same time as the textbook information. We want to make sure that we order them with enough time for you to get them for the first day of class. So there should be plenty of time at this point to work that all out. And then the other thing that I did want to mention about scrubs is this RCU Student Nurses Association that has the acronym CUSNA is also planning to have a used scrub sale during orientation week. And we're still working out all the details of the different sessions and the timeline for orientation week. But there will be an opportunity potentially for you to purchase some used scrubs from students that are graduating, because once you finish our program, you will not use our scrubs anymore. So most students will donate them, and the proceeds of the sales will go to support CUSNA for student activities and professional development. So that's just something I'll just throw out there in terms of another option. I don't know what they'll be charging for the scrubs, but I want to say it's probably around $10 for a top and a bottom. Separate, one top would be 10, a bottom would be 10, which would save you money on purchasing the new scrubs. But I don't have the pricing for the new scrubs yet, but that will be provided as soon as we have that information.
Okay, great. Thank you.
Okay, so I think I'm gonna pause there. Dr. Bowler, are you with us?
I am. Hi there.
Sorry, I just didn't see you pop in.
Yeah, here we are. I know there's a lot of people on there. There's a lot of squares on today.
So as I mentioned to you all earlier, Dr. Farah Bowler is our Senior Director of Experiential Learning, which oversees all your clinicals, simulation, and I'm going to turn it over to her and her team for the next 45 minutes or so to go over really important information. And Farah, thank you so much for being here this morning.
Oh, no, I appreciate it. Thank you, Amy. Hello, everybody. Welcome. Good to see you. It looks like there's 65 on the call today. So I'm hoping this is, I don't know if Amy mentioned, this is the first time we've done this earlier admissions information session. So I'm really excited to help get you going with your compliance. We're going to talk also about scheduling and what clinicals are going to look like this summer. So we're going to go over those things and talk a little bit about technology also. On the call here, I've got Cassie Pavlik. I don't know, Cassie, if you could say hi. There's Cassie.
Hi.
And also have Abby Zamora on too.
Hello.
There's Abby, super. And so Cassie and Abby will help me facilitate the session. So if you've got questions in the chat, Cassie or Abby are on the ELT with me, in which case they'll be answering some of those questions and navigate the chat box, okay? So let's go ahead and get started. I've just got some slides here. We'll start off. Okay, so welcome to this is our pre-orientation to the experiential learning team. So admissions day, that's today. We're going to go over schedules for clinicals, also talk about compliance and how to get started with your compliance if you haven't already, and then technology, what's going to be needed going into starting of your courses from an ELT perspective. So when we talk about experiential learning team, just to give a little bit of context to it, experiential learning is based on the idea of clinical experiences or just any experiences, but we interpret those as clinical. So you have a concrete experience, and that concrete experience could be from direct patient care, it could be in the hospital setting, it could be in the community, or it could be through simulation. So we create that experience for you. You then have some reflection around that. You think about it, you learn from it, and then you're able to do it again, either in those offsite or onsite clinical experiences. So that's why when we're named or the name of our department, experiential learning, it's everything that comes under these concepts of learning from experiences. And so we create those experiences through simulation and then also direct patient care. And that's our department is the experiential learning team. Just to give you a little bit of context also, the experiential learning team is part of the Office of Academic Affairs. So Dr. Kelly Stamp is the Associate Dean. Of course, we have Dean Eli is the Dean for the whole college. And then ELT falls under the Office of Academic Affairs. Dr. Stamp is our Associate Dean. The Assistant Dean is Dr. Tammy Spencer for the undergrad programs. And then you have ELT that falls under there. And we oversee compliance, placements, and simulation. There's a relatively large team. There's about 12 of us total. I'm the senior director of that team. And all of our teams are, again, focusing on compliance, placements, and simulation. So this just gives you some context about where we are in the College of Nursing and how we're here to support you in your learning. Okay, so if you receive an email from anyone on ELT, on the experiential learning team, please read and follow the instructions. These are not emails that not that any communication from the college you want to disregard, but this is not one that you want to dismiss. Typically, there's instructions that gives you information about your clinicals, and you're accountable for these when they're sent out and received. So please just make sure that you're flagging those, that you're identifying emails from or communication from our department. Okay. Here is, and these slides will be posted for you. I have a lot of links and different resources for you in here, so they'll be posted for you. And I'm not sure if Amy went over already your Canvas course for your cohort. And so this slide set will be available to you. This is the email address for nursing.elt@cuanschutz.edu. And all communication around compliance, simulation, or about your clinicals would go to this email address. This is then triaged. Cassie will receive these, respond to you, and then triage them to the best team member to be able to handle your question or to be able to get answers for you. Okay. So how do we do experiential learning at the college? So simulation is counted as clinical time at the College of Nursing. And you probably remember this from your interview day. We went over this then, but I just want to be very clear with you. You have simulation is clinical time. And it's referred to as on-site clinical. So when we talk about on-site clinical, that's simulation. Off-site clinical is your direct patient care agency or community-based rotation. So you have on-site and off-site. Both of those come under the umbrella of clinical time. Okay, they both make up your clinical time in the program. The mission of CEC and simulation, CEC is our Clinical Education Center, or simulations, we call it CEC and SIM, is to prepare students for clinical practice. Some of the CEC and SIM are counted for hours eligible for the nursing clinical hours for the State Board of Nursing. The majority of it is. The hours are not in place of direct patient care, but as a complement and an alternative and another mechanism for you to engage in clinical content and learn clinical concepts would be throughout simulation. Okay. So some scheduling for simulation in particular. So you get your color tracks and program plans from the undergrad program office, and you should have received those at this point. And the undergrad program office oversees all of that programming, your program plan. ELT facilitates all of the clinical schedules. So the non-course schedules would come from ELT. Once you're in the clinical track, now what we're working on is you'll be broken up into clinical groups. So groups of 6, typically, because we send groups of 6 to clinical rotations, 4 or 6. And so those are randomly assigned on these clinical groups. You will receive an email in late May as to your clinical group. These groups will change, and I'll talk a little bit more about that, but you need to know your clinical group because that's how all of your simulations are scheduled. So you'll be scheduled group Blue A, and you know that you're part of the A group, Blue A, your color track and your clinical group, and that's how you're going to look up your schedules, is by your color group. So it's not going to have Susie and Joe and Sally are all, it's not going to have your direct names listed for your schedule. They're all based on these clinical groups. With that said, your color tracks and clinical groups are not final. These are fluid processes, and it's part of regrouping and efficiencies and clinical agencies. And so these groups will move. Please hear me say that. The groups will move, and even up until the point of admissions, there'll still be some movement as we continue the admission process. Students still are coming in, and some are with maybe not attending. So know that we will reach out to you directly if we do need to change your color track for any reason, or your clinical group once you get those, but there still will be some movement up until admissions. And then typically around in fall, the fall before med-surg, or right around there, we do another process of consolidation of these groups. So know that these groups are not forever groups. It's great that you meet colleagues and your peers in the groups, but there will be movement. These are not solid groups, they are fluid. And the movement will continue throughout the program. So just an important to realize that. Okay. So health assessment this summer for schedules. So for your on-site clinicals, so simulation, or excuse me, off-site, I'm going over off-site right now, clinicals, clinical rotation, you'll have one 12-hour shift. So in the course this summer that starts in June through July or beginning of August, depending on which course, will be one 12-hour shift at UC Health at AMC. These shifts will happen Saturday day, Saturday night, and Sunday day. So you'll have one shift that you'll be assigned to, but just know we've got groups of students going every weekend, Saturday and Sunday, and there's 3 possibilities of that shift, Saturday day, Saturday night, or Sunday day that students will be scheduled. Know that we do use holidays for scheduling. So July 4th weekend will be used for scheduling for those clinicals, and that there are no changes in schedules. This is a very complex schedule, and the fact that we are working not only with UC Health, but that unit manager, those unit CNAs and the charge nurses. So to get everyone placed, it's not an easy process. No, there's multiple layers to get students into the clinical environment. So there's no changes to schedules once they are published. Clinicals will start the first weekend, which is on the 11th, June 11th. I'm just going to double check that. Yeah, it's June 11th, that first weekend. Students will start for some students. So we will start scheduling on June 11th. Okay. Let's see here. We're going to go over the on-site clinicals, and I see we have a few things in the chat box. And so we'll answer the chat box in just a moment. I'll give it a pause. So for scheduling of on-site clinicals, so your simulation this summer, health assessment this summer requirement is 33 hours. So the total course is 45 clinical hours. 12 will come for your off-site rotation. 33 will come from simulation. So you'll have multiple 2 to 4 hour sessions in a week. So there'll be usually 1 to 2 sessions in a week over the 8-week course. The sessions, if it's a 4-hour session, is scheduled 7:30 to 11:30, and then from 12 to 4. So you could be part of a morning session or an afternoon session. They're scheduled over 3 days that you're not in class. So some students will have class on Monday, Tuesdays, and then you'll come to simulation and CEC on Wednesday, Thursday, or Friday. And then students that have class on Wednesday, Thursday will come on Friday or Monday or Tuesday. So the 3 days you're not in class will have a 2 to 4 hour session that week. Every Saturday, or most Saturdays, we'll post it for you when you get your schedules. There'll be open lab time. This is voluntary time for you to use the lab space in the CEC, and there'll be a teaching or adjunct faculty there for you, but it'll be there to practice your skills. You're going to have some videos that you're going to be doing, and so you could use the space for that also, but you can practice in the space. And again, this is voluntary time. We'll have a mechanism for you to schedule this time to make sure that there's that people are divided across the available time slots. Facilities, your health assessment simulation will be taking place at AMC. We have 2 facilities, one on the 3rd floor of Ed 1, one on the 5th floor. And so your schedule will go between those 2 facilities. And you'll see that more with the formal orientation closer to the start. Okay, and again, we're going to be running sessions Monday through Friday from 7:30 to 4, a little bit after 4, and on Saturdays for open labs. And so there's no schedule changes once the schedule is released. Okay, sessions, this is a really important date. Please note this. Sessions will start on Monday, June 6th for some students. So if you start class that week on Wednesday or Thursday, your schedule could come out that you start simulation on that Monday. They're both orientation sessions to get started. And so we're starting sessions on June the 6th for this course. So even though your class might not start till Wednesday, Thursday, know that simulation may start on the June 6th, on that Monday of the first week of classes. So this is an example schedule. So week 1, let's just say that you have class on Monday and Tuesday. This is just an example. You've got class on Monday and Tuesday. Then you may have simulation on Wednesday morning, maybe CEC on the afternoon. For session 1 or session number 1, session number 2, and then an open lab. Again, that's a voluntary session on Saturdays. And then the rest of the weeks, week 2, you may still have simulation and a CEC session. The rest of the schedules should be just 1 session during the week. That could be anytime for this example schedule, Wednesday, Thursday, or Friday. And it could be in the morning or in the afternoon for scheduling. And then on the last 2 weeks, we're going to be doing CET testing. You'll have a separate schedule for that. You'll know it when we publish the whole schedule. And then CET testing for the week 7 and week 8. With that, there is remediation and retesting as needed, just letting you know there could be some variable times with that. So this is just an example schedule of what this might look like with one thing I didn't add on this example schedule, or I guess I did, with offsite clinical time on a Saturday day, Saturday night, or a Sunday day, any of the weekends throughout the course, the 8-week course. Okay, I'm going to pause there before we go on, and we'll go to the chat room, our chat here. Let's see. Okay, when are the scrubs? Okay, so we already went over that. All right.
Yeah, it looks like Cassie answered a couple other questions.
Oh, great. Okay.
One that came in, we have, are the clinical groups made up of people from within the same color group or people from across color groups?
So great question. They are made up of within the color group. So your clinical groups, each of the color tracks have approximately 60 students, maybe a little bit less at this point. But within that color track, it's then divided up by groups of 6 randomly. There's a few things that are grouped together, but for the most part, they're random placements with the groups of 6. Some of the changes may happen between color groups if absolutely needed, but typically we try to just make the movement within the color group unless there will be some movement out of the color groups at some point. So as our color group is consistent, but our subgroups are fluid. So to answer Emily's question, the color groups, we try to stay pretty consistent, but there will be some movement. They're a little bit lopsided right now in the numbers. And so as students continue to come into the program or decide not to come in, there will be some movement in the color tracks going into before admission occurs or the classes start. Okay.
Are there opportunities for makeup should we miss a session for whatever reason?
Oh, good question. So for off-site clinicals, makeup is very difficult. So it's difficult to get another shift. And sometimes we might be able to offer one to appear, but might not be able to. If everybody could mute, that would be great. I'm just getting some feedback. Yeah, super. Thank you. And so sometimes we're able to, but we can't guarantee that all sessions could be made up. It really is, we ask first the clinical agency if they're able to, and go from there. If an on-site session is missed, we'll try to reschedule you every session, or not every session, but we have a certain number of sessions, and we really depend on our ratios. So in the Clinical Education Center, we have faculty to student ratios. And so we can't just add another student onto that. So it has to be a switch or something that we don't have full capacity at, and we can allow you to get moved into another session for an excused absence or a makeup that way. If we're unable to do that, makeup could occur with mandatory open lab time. So you're able to focus on your skills on one of the open lab times. So that could be one way we make it up this summer. So how soon will we start doing this 12-hour shift in June? It'll be the first weekend. So that was, yep, June 11th. Super, Cassie, thank you. Clinical groups made up of people from within the same color group. Yes, they are within the same color group because once you split out into your color groups, you'll go into different courses. And so the clinical groups are within that color group. There are opportunities for makeups. I think I just went over that.
Yeah. So we are at, when are we supposed to find out our schedules again?
The schedules will come out the end of May. So they'll be probably 2 weeks before the start. You'll get an email with your clinical groups, with your group assignment, and then the schedules will be posted with that.
Okay, skipping down to Sierra. If we currently work in a hospital, is there an option to be placed within that system?
You can be within the system. However, there's not request for that preference as to placement. The only thing is if you are employed in a system, important to let us know so that you're not, we try to not place you within your same unit because of role development and such, and moving into the student role. So you do need to let us know if you're working within a system so that we don't place you on the same unit. So please let us know that. But otherwise,
and I just want to interject real quick, Dr. Bowler. We're collecting information if a student is working in healthcare.
super.
And that's information that I'll be sending to you probably within the next week so that you can have that kind of documented as well.
There's also an option in My Clinical Exchange once they get set up to put their place of employment if it's in the healthcare system, because a lot of the facilities will ask if they're an employee there. There might be some badging differences or ID differences, so they can put it in My Clinical Exchange.
No. So there's two questions on here. Do we just email you at the email provided if we have to miss a session and try to reschedule? Depends on the reason for missing. Excused absences, so around illness or family emergencies would be allowed, but other reasons to reschedule, personal competing items would not be allowed for a makeup session or rescheduling. Is there a way to choose our schedule for clinicals? No, there's not actually. We're scheduling a large group of students in a short time period. And so there's not requests that go with that for that time frame.
I noticed we do have a few hands up.
Okay.
Carolyn, do you have a question?
Oh, I'm sorry. I did ask Amy my question already. I didn't know how to put that down. Sorry.
No problem. Emily, do you still have a question?
I do. I have a few, sorry.
No.
So I just want to make sure that I'm understanding. So you were talking about changes in color groups and how they're a little lopsided right now. But my understanding is that our color groups dictate our course progression and schedule. So are you saying that they're subject to change currently, and then once we begin courses, they kind of stay consistent? Or are they still subject to change at that point? Because I'm just curious about the timing of courses.
No, I appreciate it. So I understand your question. Thank you for asking it. No, there could be movement in color groups in the future also.
Okay.
And so it's not something that we want to do, or but we understand that once you get into those color tracks and the progression, but it can happen depending on what the numbers within placements and within scheduling looks like. And so there could be in the future the time when those have to change, but it's our last option that we would try to do.
Okay, and I'm assuming there's some kind of like parallel between groups so that you're taking courses at the same time, but maybe or track semester, but not necessarily the same day.
Well, actually, so beginning this summer all the way through the fall, everyone's taking the same coursework.
Gotcha.
And so just might be switching of a section, but you're all taking the same classwork all the way up until December. After December is when the cohort moves into separate courses, different courses at that point.
That makes sense. Okay, thank you so much for clarifying. And then I just wanted to make sure I understood. We're only having one offsite 12-hour shift with UC Health.
That's true. This summer. Okay. This summer.
Yeah, for this assessment. Sorry, for this course.
That's true.
And then the example schedule that you showed really kind of helped to clarify, but I just want to confirm that I'm understanding correctly. So we'll know when our scheduled clinicals are from the get-go. We'll see that we have these schedules and they can occur the 3 days that we're not in class, but they won't be 3 days every week.
No.
It's just they could occur on those, and we'll know it's either the 7:30 to 12 or the 12 to 4 or whatever those blocks are.
Exactly. So it's a total of 33 hours in the lab, and those are typically in 2 to 4 hour sessions over the 8-week period of time.
Okay, that is super helpful. And then the final two, sorry, I have so many questions. What's the mechanism for scheduling that open lab time? Will that be through my clinical exchange, or is that somewhere else?
It's going to be when the students, when the schedules are released, you'll have a sign up genius. And the sign up genius is just a mechanism to go in and reserve time for those open labs. Okay,
perfect. And then just some clarification in terms of what my clinical exchange is used for. So is that where we'll go and find our like subgroups, or what do we use that for?
Yeah. So I'm going to go into that next. That's the next topic for this orientation. So we're going to move on. Okay. It looks like but thank you for those questions. I think we got everything that you just answered asked, and then we'll move on to my clinical exchange. Okay. Does that sound all right?
Yeah, that's perfect. Thank you so much.
Okay, super. So Jennifer, we don't, you don't have to wear scrubs in the classroom, but you do for any of your simulation time, any of your clinical time. So the two places, I'm just going to finish up with schedules, and then we're going to move into compliance and then talk about my clinical exchange and ADB. So where do I find my schedule? So the first thing that's going to happen is your ELT will be sending out the groups for you. So you'll know your assigned group, and that will happen again later, a little bit later in May. From there, your offsite clinical schedule will be posted in my clinical exchange. And so that's where you're going to get your information from that. And then your on-site clinical schedule will be posted in your on-site clinical simulation Canvas course, which you're going to have access to at the end of this. So I'll show you how to get access there, but that's where the schedules will be posted. Also on that simulation course, I think it does list your dates for your offsite rotation. So you'll see it there too, but typically my clinical exchange is the main mechanism for knowing what your dates are for clinicals. So we're going to move on to, here we go. The dress code policy. We've gotten actually quite a few emails around the dress code policy. So please, if you haven't already, Amy, if you're still on, is the dress code policy in the handbook are available for students now?
It is, yeah. And I've sent that link to students a couple times, and I think I'll probably include it on the announcements as well in the Canvas shell, just so students can refer to it if they haven't seen it already.
Okay, super. So please, great proactive questions coming from students regarding the dress code policy. So if you haven't already, please review that just to make sure you're ready to be in alignment with it. So That's all I'm going to say about the dress code policy. We'll go into clinical compliance. What time is it too? Okay, we have a few more minutes. Okay. So talking about compliance. So our department, ELT, also covers compliance because most of the time it's aligned with your clinical rotations or your clinical requirements. The two systems that we use for clinical compliance, one is American Data Bank. You'll also hear it referred to as ADB or Complio. CU Nursing does not own this account. This is an account that you pay for. It's your account. And then you allow us to look at that data, look at that information, and send it on your behalf to the clinical agency. So this is a student account. It's the primary database that we use for all compliance information. So we'll go into that a little bit more, but I want you to know that we have American Data Bank, and then we also have My Clinical Exchange. And My Clinical Exchange is the system in which it actually syncs information from American Data Bank. So it holds, then it has information, which we'll talk about a little bit more. But then that the My Clinical Exchange is how we communicate with all of our clinical partners. So the clinical agencies also use My Clinical Exchange. We assign students to a certain rotation at the facility, and then the agency looks at My Clinical Exchange. They see that you're compliant. They post things that they have required for their agencies, which we'll talk about. But it's My Clinical Exchange is the liaison, the communication method between schools, students, and the clinical agencies. So they don't have access to your ADB for compliance. They only have access to My Clinical Exchange. So you upload information into ADB, it syncs to My Clinical Exchange, and that's how the information gets to the clinical agency for your rotation. So those are the primary two systems that we use for clinical agency for the compliance. Okay. ADB sends an expiration notification 90 days and 30 days. So listen to those. Please do not send those. Check your junk, that it could be in your junk or your spam in a mailbox or inbox. But you want to keep an eye out for those. Common items that require renewal. You will have, so you're doing a large upload now to this to make sure you're compliant for admissions. Know that things will expire throughout your program. Very important that you're on top of those. Again, you'll get notifications from ADB. Set a timer, put it on your calendar that it's going to be, this is when things expire for you and when you're going to need to upload those. Again, I'm going to be posting these so you can use these links. I'll post these slides for you. American Data Bank, there is the link for access and how to create your account. New users, there's a button in the right-hand corner that you're going to pick that. There's a University of Colorado package. It's going to be in a bundle. Once your account is active, then you can request your background check. You can also complete the OSHA and the HIPAA that's there, the documentation that's there, and then you can upload your other immunizations, CPR, and which I'll talk about in just a moment. You can also order your drug screen there too. If you have any issues with uploading your account or creating your account, here's some support from American Data Bank, and then also the email. So there's a phone and an email support. Okay.
I have a question.
Sure.
Regarding like the flu vaccine,
Uh-huh.
if we got our flu vaccine after like the dates that's in American Data Bank, do we still need to report it somehow?
You can report it one from this previous year if you'd like to, but otherwise it's going to be that's going to come due the next year. So you'll see it in an annual. So every fall, typically it's in October that's due. So you'll see it come up then.
Okay, so then if I didn't get one in 2021, then just don't report anything.
What does that look like, Abby, on our end as far as compliance? Do they need to have one documented for this year if they're joining now?
Because we are coming out of the flu season, currently right now the flu vaccine is not required in ADB. But once we hit, I'm so off on my months. Once we hit like August, it will then become a requirement again.
So right now it's non-required, but it will be required during the annual year. Typically that happens in September, October timeframe for the next year. And then you'll see it come up as a requirement.
Okay, thank you.
All right, Jordan, did you have your hand up here?
Yeah, I was just curious if we're folks that hold previous certifications. I didn't see a place for that. So in clinicals, if I'm an EMT and I have an IV therapy certification, is IV something I could even do? Is that at clinical provider discretion, or how does that whole process work?
Yep. So there's no reason to put any certifications in because they're not necessarily applicable in the student role. So that even if you had different certifications, you're still functioning under the student role. For students, you're able to put in IVs during your clinicals. You can't do anything out of scope of your student role, even if you have certifications in a professional role. So if you went to clinicals, health assessment and foundations don't have, aren't under the registered nurse or are precepted by the registered nurse. So you could not do IV therapy or administer medications or do anything without that preceptor, even if you were certified in a professional role. As a registered, when you're precepted by the registered nurse and your med-surg clinicals and forward, you can do IV therapy and other things with your preceptor there.
Perfect. Thank you.
Okay, super. Okay, I had recorded, but now showing I'm not compliant. I have a second shot before school starts. At what point series be approved in the system? So the system so the way that ADB works is that it's either approved by ADB. They go through and review all of these on their side. At some point, if we're seeing that it's not being reviewed, we can go in and take a look at it also. But we wait for ADB to review those. So if you have any specific compliance questions about your previous compliance or immunizations, I should say, please send those to us directly and we can help you navigate those if you have questions. Okay, let's see here. Okay, so now I'm going to move on to my clinical exchange. Did I pass something? Hold on a second. Oh, yeah, I went through that. Okay, super. So my clinical exchange. So that's the second system to get access to. Please upload your College of Nursing headshot photo when those are released by Amy, or when those are finalized and you have those. That's the headshot that you're going to want to upload into your My Clinical Exchange. These pictures go out to all of the clinical agencies, so you want a professional headshot to be part of your profile, because again, these are communicated out to all of the clinical agencies. You're going to register using your CU Anschutz email account. This is really important for your MCE account. If you put your personal email account in there, we've had situations where the email goes to that personal account, it's not checked, or it goes into a junk, a spam account, and the communication's not received. So please, for your ADB and also for your MCE, have that be your UC Anschutz email account. The specific documents will be pushed out so the clinical agencies go into My Clinical Exchange, they award the placement there, and then they're going to identify what things they need for their agency. And so that one, we're going to talk in just a second about what that looks like, but My Clinical Exchange is where you're going to go for agency compliance. They're going to tell you what they need for to go to their agency onboarding. And so it's going, that's what you're going to get from My Clinical Exchange, and why you need to be aware of the deadlines in My Clinical Exchange. Okay. Technical difficulties, there's a link for that also. And then My Clinical Exchange, here's how you register. There is a fee, a one-time fee of $35 to register for My Clinical Exchange. To create a new account, you're going to go to the top of the web page, and it says students at the top. The one in the middle of the page is already if you're a student with an established account. If you go to the top and you see the link for students, you're going to do registration, create a new account. You're going to enroll under University of Colorado, Denver. You must use your CU email account. and then connect the count to ADB. So these two accounts link and they sync together, so that then the information that you put into ADB, all the compliance information, then pushes out to your My Clinical Exchange account. Okay. And then upload your photo labeled last name, first name. They're pretty particular about the labeling of that. So you want to make sure that's labeled. There's a few things that does not sync and that do not sync from ADB. If you're a VA employee, there's some things around that. Influenza administer date. So you can manipulate data in My Clinical Exchange. So you'll see if something doesn't push over, that you may have to put it into My Clinical Exchange also. These are just 3 examples, the COVID vaccine brand, and they're just things that we've learned over time that don't sync. Most everything else does sync, but these are some that don't. Okay, so let's talk about required immunizations on admission. Okay, this is what you're doing now. MMR, your Hep B, varicella, Tdap, TB, you can do a quantiferon or the 2-step skin test. If any of those results come back inconclusive, then you need further documentation from your medical provider to get a medical clearance. An inconclusive result is not going to be sufficient for placements. For you to be to go along with our affiliation agreement. So you need to have some further documentation about that. And then COVID-19 vaccination, complete series with booster. And I'm going to talk about COVID-19 in just a second. These immunizations on admission, I should back up just for a second. This isn't just the College of Nursing. I'm saying we really want you to have these and show you to be a student. We have affiliation agreements with all of our clinical agencies, and that's a document that is a contract between us and the clinical agency. And they say to send students to our hospital or our community-based center. These are all of the immunizations and other requirements that we need to have that student there. And we signed on the dotted line and said we would only send students that have complete immunizations completed and meet all of the requirements. So this is a contractual thing between CU College of Nursing and the clinical agency. So that's where all of the immunizations and other compliance things come from and why they're so important. So these required immunizations and this compliance due May 11th. Okay, so that date, May 11th. Next, you also have HIPAA, OSHA, and the American Heart Association Basic Life Support. HIPAA and OSHA are going to be part of your ADB account. So once you go into your ADB, you can take the HIPAA and OSHA there. The OSHA does is an annual due date. And so go ahead and tag yourself, make a notification 1 year from the date that you have completed it, it will be due again. And so when we talk about annual compliance, this is one thing that will fall out of compliance. American Heart Association, it needs to be AHA. A lot of our agencies do not take American, the Red Cross, so it needs to be an AHA. It also needs to be, it can't be just an online course. It needs to have the skills portion of the course. So the American Heart, not the health code, only has the online portion. You need the skills portion of that course. And then the background check and the drug screen on admission, and those can be facilitated through ADB. Again, due May 11th. Okay, COVID-19, right after this, I'll pause. I see we have a lot of questions or messages in the chat, see if there's anything that hasn't been addressed. So COVID-19 on campus, hopefully we're on getting to a better place. I feel like we're coming out of the pandemic a little bit. Vaccination and boosters are required. You're going to upload this information into ADB. So that's where your main database is going to be, and it's going to push out to My Clinical Exchange and then also to our clinical partners. Additionally, so step 2 of this is to submit it to your CU and Shoots the central system. And this is a way to see all students on campus and our vaccination rates for the total campus for the whole staff, student, and faculty. So here is the link. Again, I'll post these for you. So 2 things with COVID, you're going to put it into ADB. You're also going to put it into our central system. And then here I have the COVID web page for you. It has it has a dashboard for campus. It also has policies, procedures, self-reporting. So great place for resources around COVID-19 on campus. Okay, it's expected that students monitor their ADB for expiration dates, follow up with renewal compliance no later than 2 weeks before the expiration date. This is the worst communication I have to send out, I think, is you're unable to go to your clinicals because something you're non-compliant in the area. And I hate sending that out. So please, really important that you're proactive, you're accountable to your compliance, and that you've got those dates and you know when they're coming up, and you're really being proactive about making sure you're compliant with those throughout your program, not just on admission. Okay, I'm going to pause there because we have a good bit of questions, and then I'll talk a little bit about agency compliance also. Let's see.
So Farah, the next question in the chat is from Emily. Is RQI sufficient to keep it current? I'm not sure what that's in reference to.
I don't know either. RQI sufficient to keep it current. What is that? I'm sorry, Emily, can you tell us more about that? No worries. Okay. She says no worries. So if you have another question, you can post it for us. If research shows to benefit from second COVID booster shot, could this become a requirement for us? Everything with COVID and requirements around COVID has been very fluid. As we all know, moving through this pandemic, having not been through one before, everything is subject to change and new requirements. Right now, the first booster is required on campus. Not all of our clinical agencies are requiring it, but it is required on campus. We haven't heard about the second one yet, but you know, definitely leave that open that could be a requirement in the future, but it isn't right now. When OSHA HIPAA is expired, do we get notifications from Complio? You do, 30 days and 90 days. That's why you want to make sure it's going to your CU Anschutz account, and you're aware of those. All right, super. Okay. That's a good question. Amy, do they have separate pictures, or is the headshot the same one you use for badges?
Yeah, the badging photo was just something that students uploaded, but we will
Okay.
have a professional photographer on campus during orientation week.
Okay. And so you can once you do the professional headshot, then that's the one you can put into MCE. Okay. Okay, so if you have specific, I'm just going to say, I see a few questions about compliance. If you have specific compliance to your own immunizations and questions about that, please email them to us and we can help you navigate those, okay? Cassie will be glad to answer those for you. So I'm not going to get into the specific ones right now, okay? But
Farah,
reach out to us.
Marisol has their hand up.
Oh, okay, Marisol?
Yeah, I was just gonna ask, so I already registered for my clinical exchange and the Complio. I just don't know how to link both of them together.
Okay, Cassie, can you put in the chat how to link the accounts? Okay, super, thank you. Great question, Marisol, thank you.
Thank you.
Okay. So we're going to talk a little bit about clinical agency compliance. That's different than your CU medical compliance. So your CU medical is all the immunizations and the other things that you need to be a student here, and that goes into American Data Bank. As I mentioned, clinical agencies have their own requirements. Most of them are the same, that align with what we have, meaning you're not going to need to get any other testing per se. However, they're going to have agency-specific paperwork that's due. They're going to have their own handbooks, they're going to have consents, they're going to have a variety of other orientation things that they need you to complete, and those will be communicated through My Clinical Exchange as to those requirements. Read all the instructions, complete all requirements. If those aren't completed, they can deny it and will deny, it does happen, your placement, because these aren't in place when they need them. They receive those and then they do a whole other process on their end to have students there. So it's really important that we align and are diligent about making sure these are in on time. Okay. Failure to complete agency-specific requirements, which includes the clinical compliance, could result in a denied placement and delayed graduation, which I hate more than anything. So just make sure you're on top of those. Okay. So coming up for summer of 22, coming up, you have CU nursing compliance, May 11th. That is due. That's all your immunizations, OSHA, BLS, HIPAA, background check, your drug screen, all of that is due May 11th. Due June 9th. In your MCE, your
I'm sorry, I don't work. I'm sorry, I don't know anything.
What's that? If everyone could go on mute, that would be great, unless you have a question directly. So 2 dates coming up. May 11th is your nursing compliance. That's in your ADB that you've got things due there. And then your UC Health agency requirements are due June the 9th. Okay, that's Thursday of your first week of classes. You're going to find those once your placement is in My Clinical Exchange. You'll find it under the placement for health assessment. They want you to do a code of conduct, a confidentiality statement, and a student handbook. And you're going to complete those 3 as your agency compliance to go to your UC Health rotation. Okay, I've also added these to your Canvas course calendar. So those should be in there. Every block, this agency requirement. So even though you did agency requirements for UC Health, for health assessment, they'll be due again for foundations. They'll be due again for MedSurg 1, no matter what agency you go to. So know that you're on top of those every block and responsible for that compliance piece. Okay. All right. Let's move on to technology. I know we're running a little bit behind. Sorry, I'll be quick, Amy. As far as technology goes, you're going to be using 2 platforms, 2 pieces of software. One is called Elsevier, the simulation learning system. You'll be using this throughout your whole program for simulation. These are pre-published simulation scenarios and programming. And so you'll purchase it now. We'll use it the very first week of your courses in simulation. You'll use it throughout your entire program, the SLS. So this is one, you want to purchase it in the bookstore, either individually or part of the bundle, or buy it directly from Elsevier. Please do not purchase it from a third party. So don't purchase it from Amazon. We've had a lot of bad luck with third party purchases, meaning having invalid codes and such with that. So don't recommend going through a third party. All products are copyright protected. So that means no sharing of the account. You can't buy it from somebody else or get it from somebody else, pass it down their account. You need to have your own account, your own code to use. No sharing of access codes. Again, it's a copyright violation and a violation of the honor and code of conduct for the College of Nursing for that. Clinical essentials. This goes along with Elsevier. One, the SLS are the simulations themselves, the cases and everything to go with that. The other component of software from Elsevier is the clinical essentials. These are 140 different skills that you'll be learning throughout the program, some that you might not learn directly, all of the different skills for entry-level nursing. With this, there's a video demonstration, there's quizzes, there's checklists within that. You have unlimited access, and this is our main resource for skills. We know that textbooks, you may not purchase the textbook, you may not have it readily available, it's big and clunky when you need it. And so the clinical skills essentials will be your go-to and our go-to for any skill acquisition or referral or resourcing will be the clinical essentials. Okay, so both of those you can purchase through the bookstore, through Elsevier, or with your book bundle. Again, I'm going to post these slides for you. We'd really love, if you're able to get access to Canvas before you come into orientation, would be great. You will be using SLS and Clinical Essentials the very first classes of the very first week of your program. So June 6th. We'd like you to be in Canvas. there's your own on-site clinical simulation course. And this isn't a registrar course where we register and it pops up in Canvas for you. This is one that you self-enroll. So here's a self-enroll link. Again, you can get it from these slides when I have them posted for you. And you're going to go in and self-register for the on-site clinical simulation course. And there is where we're going to post your schedules. It's also where you're going to access all of your simulation throughout the program is through this on-site clinical simulation course. So you're going to want to try to get access before orientation. Once you get into the Canvas course, that's where you're going to redeem your Elsevier. You can either redeem it when you try to access some of the material in the on-site clinical simulation course, or you can go to the Elsevier website and access it there. They're going to sync your two accounts, meaning they're going to sync your CU and Shoots accounts together between Elsevier and Canvas, and the material is going to be available to you on Canvas so that you don't have to go to the Elsevier website each time you use the material. So, that is my request to do to get those two set up before orientation, so then we can help orient you and troubleshoot. Okay, you do have an assignment with those clinical essentials, some of those modules. There's going to be more information in your cohort specific Canvas course. There'll be more information, but they're going to be due on June the 9th. And there's several clinical essentials modules that need to be completed before you go to clinicals. So they're clinical preparation modules. So just wanting to put that you will be using those clinical essentials for an assignment that's due that very first week. Okay, there'll be more information on there about it. Okay, so everyone needs to have purchased the software starting off the semester. If you're able to do it before orientation, that's even better to make sure you're in the system and ready to go. So great. All right, this is the last slide here. Action items, important dates for you. So action items, create your ADB account and your MCE account. You're going to link those two together. Make sure those accounts are set up. And then start also your compliance within those. Purchase your SLS and clinical essentials and obtain access. The link that I just provided for the Canvas, you're going to do that. CU nursing admission compliance is due May 11th. UC Health agency compliance and onboarding, again, you're going to get that from My Clinical Exchange under your health assessment clinical, your clinical rotation that's in there. And that's going to be due on June the 9th. Your clinical sessions, your on-site clinical sessions for some students will start on the Monday before classes start, meaning the Monday of the week of classes starting on June the 6th. And then off-site rotations can be begin on June the 11th, as soon as June 11th. And then I just mentioned the clinical essentials modules for UC Health clinical preparation will be due on June the 9th also. And there's more instructions in the modules as to what needs to be completed and where to submit those, et cetera. So, okay, that's all I have for this. It looks like we have some questions. Looks like Abby, you've gotten a lot of those.
Yes, I think I've been getting most of them.
Okay, so Cassie's done those. How do we get to our Canvas? So super, somebody, thank you, Maddie. You posted it here. Also, these slides, you'll be able to review the slides and the link will be in there for you too, to the login. Okay. Oh, got it. Great. So Amy Sturrock is going to have the 2022 traditional pathway Canvas shell. And that's where these slides will be posted. There'll be some compliance resources in there for you also. And then announcements will go out. I also populated some things in the calendar there with the dates that we just reviewed together. Okay. Are offsite clinicals always on the weekends, or is this unique to health assessment course completed this summer? Weekends are used, but it is somewhat specific to the for health assessment and foundations, because you have a heavy course load and a lot more simulation in these first two courses. And so the weekends are used for those rotations for health assessment and foundations. We do use weekends for other rotations, so it's not off the table. However, However, it's not always on the weekends. Usually it's actually more likely it's during the week, but we do use weekends also. Okay.
Then we just have some raised hands still, Emily and Marisol,
Okay, super.
or Emily.
Sure. I just had a question about the SLS and clinical essentials that you had
Okay.
talked about.
Sure.
So I know you said these slides are going to be available. Do we have an idea on when the slides will be available so I can click and make sure I have the right thing, or can that be emailed out so we can get that ordered?
Yep. Amy Sturrock will publish that course for you this afternoon, and these slides will be in there. So you should have these slides this afternoon for access to them and the links that I provided in there.
Okay, wonderful. Thank you so much.
Sure. And Amanda?
Yeah, I just wanted to confirm Elsevier is going to be a part of the book package.
It
that
is,
we can
yes.
purchase. Okay.
So you can, if you're able to purchase the whole book package at once, the SLS and the clinical essentials are part of that bundle. If you prefer not to do the bundle for whatever reason, then you could purchase the clinical essentials and the SLS outside of the book bundle, excuse me, or you could go directly to Elsevier and purchase it directly from them. Okay.
Thank you.
That was a great question, Amanda. I just piggybacking on that, do we know when the book bundle, Amy, you might have mentioned this, will be available? Because I would like to do the bundle if I'm going to purchase, but I want to get that set up per your recommendation, Dr. Bauer, kind of sooner rather than later.
Yeah, so from my understanding, Emily, the textbook list is in the final stages of being approved. And then once we have that information, Dr. Spencer will put together the textbook information as well as a welcome letter outlining exactly what's in the bundle, how much it will cost, and the ordering information. So just stay tuned.
Okay. So Betty asked, when do we start receiving announcements on Canvas and dates on the calendar? As soon as it's published. Amy said she's going to publish it this afternoon. And so you'll start getting them from there for this particular, and this is just a cohort. It's a place for us to communicate, to connect, provide resources for you. So it's not a course specific, it's just a Canvas shell where we can provide things for you in there. Okay. Somebody asked, how does clinical placements look during breaks for the didactic schedule? Is it likely we'll have clinicals during breaks? It is likely. We do use the winter intersession. So winter intersession is at the end of block 2 in the fall. So it's beginning of December. Typically after the holidays, not typically, but if we are going to run a winter intersession, it will start right after the new year for those 3 weeks before we start the next semester, spring semester. So we use that. Sometimes there is some overflow into May, but not typically. Winter intersession would be the time that we would do overflow, and you may have some clinical time then. Okay. All right, Amy, I think that's it. Everyone has the nursing.elt. So if you have questions about compliance, if you have questions about simulation, about schedules, about clinical placements, any of that, you can contact us and somebody will respond from the team. We look forward to having you. I'm glad we're able to do this day. Hopefully this gets you started on your compliance and have an expectation of what's going to be occurring this summer when you start the program. So great to have you.
Thanks so much, Dr. Bowler. And to answer Kelly's question, yeah, if there's something posted on the summer of 2021 cohort out on that clinical course that Dr. Bowler mentioned, it will be updated. So just stay tuned to that.
Okay. You said that Canvas shall be updated. The on-site schedule showing for spring 21. I'm not sure what that is. We can go in and take a look.
Yeah.
Oh, on the Canvas that you're referring to the on-site Canvas, I think
she
Kelly.
is, yeah.
So that's an on-site. So all know that the on-site clinical simulation Canvas that I gave you the link to is for our whole simulation program. It is not only for TRAD 22, it's for UCAN, it's TRAD 21, it's for the entire simulation program. And that's why we don't post your names, so that not everyone, 500 students know where Jennifer is on this date. It's all by groups. And so know that you'll see all courses in there. You'll see all schedules. Announcements are for all of simulation. They're not just specific to trad 2022. And that's why you see that schedule there. It's for another cohort. Yours will be posted later in May when it's available.
Thank
Okay.
you so much, Dr. Bowler.
Okay, bye-bye. Thank you.
And thank you, Abby and
Thanks,
Cassie.
You're welcome.
So Joanna Cabrera Rosas is also with us this morning. Thank you, Joe. Sorry for the delay. There's always so many questions for Dr. Bowler, and they're always so important, so we don't want to miss any of those. So I know that Joe sent me earlier today the general financial aid handout that you all actually should already have a copy of, because I'm assuming, Joe, it's the same one that you've used for this group in the past.
Yeah, it's a little bit updated because this is the orientation version.
Oh, good. Okay.
Yes.
Well, I will shoot that out to students by email here. And so Joe is our main financial aid liaison for the College of Nursing, and I'll let her take it away. Thank you so much for being here.
Yeah, thanks, Amy. So good morning, everyone. I'm going to start by sharing my screen here so that we can follow along with my handout that will be sent out to you guys shortly. So this one is really tailored to orientation and things that you should be on the lookout for that'll happen a little before you actually start your summer term. So to begin, and just reminders at this point, just make sure that you've completed the 21-22 and the 22-23 FAFSAs. We need both of those as soon as possible in order to be able to award you financial aid without additional delays. Also, just remember the FAFSA goes live every October 1st. So this October 1st, you will have to do the FAFSA for next academic year, and then that'll get you through your program. I did go ahead and update our 2021-2022 cost of attendance here. The one we had originally was from 2020, but now we have updated our cost of attendance. We have both the summer and the upcoming fall available on our website. So you'll be able to view those and kind of see a more detailed breakdown of expected tuition fees, living allowance, and those types of things. They are available on our website. This is a very condensed version of our table on the website. So the main thing here that I want to make sure that we're all aware of is the financial aid award for the summer semester. You will get a financial aid award for summer, provided that we have your FAFSA, but you also need to be a junior senior status. And so because we know that there are transcripts that need to be reviewed and everything, there may be a little bit of a delay in getting you a summer award. It is very typical that students receive a summer award at the end of May to the first week of June, which is typically around the time that you're starting your program. So this is just to kind of put a reminder out there not to panic if you don't see an award mid-May, because we have to wait for any transcripts and transfer credits to be updated, and you have to be a junior senior level on the system before we're able to award you. Regardless though, you will get an award either the end of May to early June. Tuition isn't due until later on in the semester, so we wouldn't worry about late fees or service charges or anything like that. And then let's see here, just another reminder, if you are attending a school right now, or during the fall semester, whatever type of aid you received there is going to be reduced from the annual loan limit, and we will award you the difference. If you're Pell eligible, we will award you the Pell automatically as long as you fill out that FAFSA. You don't have to worry about doing anything else. And then let's see here. Another major thing is if you choose to charge your anything really to your student account, charge your books, or if you are going to be taking out our students' health insurance, you need to make sure that your balance is at zero, even if you get a refund, because sometimes what the bursar's office may do is they may issue a refund out pretty quickly and then realize, oh, okay, there's health insurance costs, or you charged your bookstore charges or whatever it is. And so then you'll actually have a balance even though you received a refund. So we always recommend that you make sure that your balance is indeed zero for the summer term before you start spending any financial aid refund that you may receive. All right. Just other things to be aware of here. Will you be taking the school's health insurance? If you will, there's nothing additional you really have to do. If you're covered under, Medicaid or your parents' insurance or something like that, or employer insurance, then make sure that you actively waive out of health insurance. The health insurance office will be sending out an email probably early May with a link to how you can waive out of that health insurance. If you're not sure if your specific insurance covers what is required, I did put the health insurance office phone number on this handout so you'll know who to contact to ask those questions. As a reminder, if you are a Colorado resident, this program is eligible for the College Opportunity Fund stipend. So just make sure that you authorize COF both on their website, which I've listed on this handout, and on our UCD Access portal, so that you can make sure that you're getting that discounted tuition rate. Other things is once you have a financial aid award, we will email you to your university email account. That's the only account that we're going to be emailing. So please make sure that you're monitoring that at least during the first few weeks of the semester for us, because we won't be emailing you elsewhere. So we will email you letting you know if financial aid award is available, but then you also need to do an additional step. After you accept any financial aid for the summer, because this is the first time you're going to be borrowing financial aid through our school, you will need to complete an entrance counseling, which is counseling about the Stafford loans. And you will need to do the MPN, so Master Promissory Note for Stafford loans. Both of these things are done online. I have the link on this handout, and the link will also be available on the email we send you. So just remember that there is an additional step after we award you financial aid. Both of these things do take about 3 or 4 business days for us to receive. So it is in your best interest to do them shortly after accepting your aid, so we can get those pretty quickly. Just another little tidbit here with work study. If you are interested in work study, you would indicate that on your FAFSA, and you would also just give us a call or fill out the work study request form that we have available on the website. That way we can actually award you work study. All right, so if there's any special circumstances, is there anything that specific to your situation that you want to talk about to see if there's any appeals or something like that? Definitely reach out to me. We could talk about childcare appeals, computer appeals, all of those things. Just be mindful that the annual loan limit for Stafford loans is rather low. It's that $12,500 for independent students. So in a lot of these circumstances, an appeal would only really mean that you could apply for additional private student loans. But regardless, we're able to talk about your situation if you have any questions related to finances, and we'll kind of see what can be done in those circumstances. But again, most of these appeals do result in private loan eligibility, which is basically a loan through any lender of your choosing outside of school. So here I have updated our advising hours. We do have advising hours, which means that you're able to call at any time, Monday, Tuesday, Thursday, Friday, between 9 a.m. to 1 p.m. To speak with an advisor. You do not have to schedule appointments. You do not have to actively come in to see an advisor. You can talk to an advisor over the phone. If you prefer face-to-face, we also have the Zoom link right here. It is on our website as well. We are available on Zoom these Monday, Tuesday, Thursday, Friday from 9 to 1 p.m. So these are updated advising hours. Just know that you don't have to schedule an appointment to speak to an advisor. And I have our phone number listed right there. Okay, just other little things, grants, it is first come, first serve for institutional grants. So you want to make sure that you're filling out that FAFSA pretty as soon as possible. annually to be in the best running for grant funding if you're eligible. But the Pell Grant, that one, regardless, if you're eligible for it, you will receive it. So we're not running out of that. It's just the institutional grants that are first come, first serve. These are only awarded during the fall and spring semesters. So for summer, we don't have any grants besides the Pell Grant if you're eligible. For scholarships, I did list a couple of resources here. For external scholarships and then internal scholarships, you would have done those through College of Nursing. They do open annually, so you want to make sure that you're keeping an eye on for when those scholarships go live internally again. College Opportunity Fund, right here, I did put a little bit more information. If you're having a hard time getting that to work, you can call the registrar's office at this phone number here for information and instructions. And then here I just went ahead and put the Stafford loan limits for dependent and independent students. For dependent students, you would qualify for a Parent Plus loan, and the Plus loan is a loan that your parent takes out for you. Independent students do not qualify for the Parent Plus loan and will not be awarded it. I did put a little more information here about private student loans. Just basically loans through any lender of your choosing that you apply for outside of school, and then they send us notification and we process those as needed. And down here, I did go ahead and put different resources. So College Opportunity Fund website, if you are if you have any type of GI Bill, or if you're a veteran, or have any benefits from parents or family members, you want to make sure that you're reaching out to the Office of Veterans Affairs so that you can get all of those in place by the time the term starts. If you want to review your loan history to see how much Stafford aid you've taken out for your entire academic career, you can do so at studentaid.gov. You would log in with your FAFSA username and password, and that'll have the information there. If you have any questions about payment plans, or if you have any 529 plans, college plans that would help pay any of your tuition expenses, you can reach out to the bursar's office right here. That's their phone number. They're our billing office, and they also have information about payment plans and the deadlines. They do have this information on their website as well. And lastly here, I do have the student health insurance phone number if you want to reach out to them with any specific questions about waiving or requirements that the health insurance office has. So yeah, oh, for the registrar's office, I did put their phone number on here. If you're currently and in repayment, so let's say you were in school and then your loans entered repayment, so you have to make monthly payments, but you're starting this summer program, you want to make sure that you place your loans back in school deferment, and those forms are processed by the registrar's office because they have to put an official school seal on there. So if you have any of those or any residency questions, you can reach out to the registrar's office. Okay, so let me stop the share real quick and go here to the questions. Oh goodness. Okay, so let me go back up to, okay, so let's see. If we have been in school for a while prior to this program and are nearing our limit for Stafford loans, where do we go to apply for outside loans? Okay, so really outside loans are considered private loans, and they're anywhere. It could be through your bank. It could be through major lenders like Citizens, Discover, Sallie Mae. So or any credit union that you work with, really it could be any lender of your choosing. We're not allowed to have and to recommend any lender specifically, but just know that we will work with any lender of your choosing. But those are the major ones. The big ones we see are places like Citizens, College Avenue, Discover, Sallie Mae. All right, so I have Medicaid and also Blue Anthem with my job. Can I use the Blue Anthem? So I'm not sure. You would want to double check with the student health insurance office because they'll know if your insurance has the requirements that they need. Okay, so do we need to go through the appeal process if we know we will need to use private lenders, or can we go to them directly? I'm sorry, which appeal process? Oh, you don't have to fill out an appeal if you don't need to. If you know you're going to need to go with a private lender, that's fine. You don't have to fill out an appeal for us in order to go through a private lender. You can go to them directly, and then what they do is they notify us that you've applied for a private loan, and then I process accordingly. Okay. What would we do if we have a big change of income that is different from the last W-2 submitted? So yes, Maddie, so we can potentially look into an income appeal for you. Now for the summer semester, it really might not make much of a difference because grant funding, we don't really have any grant funding, but for the upcoming fall semester, that is something that we can look at. You would want to give us a call first so that we can see what your income is now, or at the time you give us a call, so that we can see if there's any type of benefit for you filling out an income appeal. Sometimes, you know, it really won't change the Stafford loans we're able to give you. It may make you eligible for a Pell Grant or something like that, depending on if this is your first bachelor's degree and those types of things. So we need to review it specifically with you. So I would say just give us a call and we can look at your specific file and go from there and see if it's suggested or it's advised to do an income appeal to replace your income now with previous income. Can we apply for scholarships without completing the FAFSA? Yes, you can apply for scholarships without completing the FAFSA. However, I think that a lot of scholarships prefer FAFSA on file. Again, it's not a requirement though. So yes, you can fill out for scholarship applications without a FAFSA. All right, if we have already met the junior senior credit level, when should we expect awards to come in? So you need to, it's not that you've already met it. Most of you guys would have, right? Or all of you would have. But the thing is that you need to reflect that on our system, and the College of Nursing updates our system. And so you have to basically give them some time to update that on our system so that we can give you a financial aid award. So typically you can expect those awards at the end of May to the first week of June. Okay, so if I've authorized COF for CU Denver, do I need to redo it for Anschutz? I understand FAFSA is applied through CU Denver already. So I don't believe you have to reapply it because we share that same school code, but I would just double check with the registrar's office to make sure that you're good to go. But I'm assuming it's fine. Okay, sorry. Okay, so let's see. I think I have answered all of the questions. Are there any other questions?
This is like a first, Joe.
I know, right?
Normally we're running over time.
Yes. Yes. Well, this is very exciting. I do know that maybe
it looks like there is a hand up. Bria, if you want to go ahead and unmute and ask Joe your question, go ahead.
Okay. Hi. So I don't know if this applies to you. I'm trying to authorize the COF fund, and I reached out to them and they said it will be available through the college portal. So I have to, it says, good morning. Once the COF account is created, then you aren't required to log in, nor are you able to do anything else on the site. The authorization part is done through the college portal in order to utilize it there.
Yeah. So you do have to do both. You have to make sure that you have an account with COF, and then you have to authorize it through our website, through the UCD Access portal. So once you log into the portal, there should be something where it says like, do you want to authorize COF for the term or for lifetime? I recommend you do lifetime so you don't have to remember to authorize it every semester. But if you're having issues on getting that done, then the registrar's office can help you.
Okay, great. Thank you.
Mhm. Any other questions?
Thank you so much for your time, Joe. Hope that you have a great weekend.
right.
So students, I think we'll just pause for a little bit. Our next presenter is going to start at 11 o'clock. So I'm happy to stay on and answer general questions that students have before 11. But if you need to use a restroom break, or you just want to jump off Zoom for a few minutes, please make sure you're back on, maybe a minute or two before 11.
All right. Thanks. Bye.
Thanks, Joe.